Bismillah ar-Rahman ar-Rahim. Rabbi shrah li sadri wa yassir li amri wahlul uqdatam min lisani yafqahu qawli. Assalamu alaikum rahmatullahi wa barakatuhu, my dear brothers and sisters. This is Dr. Nyer Firdoose, and today I am presenting a very basic topic, which, being very mundane, is a very important part of our clinical and professional practice, which is how to reach a diagnosis. In common terms, it's just taking a case history. I thought I'll make it a little interesting by changing the name. I will be very brief, and it's going to be an overview of the case history aspect. Okay. What exactly is a case history? It is a classic form of documentation ranging from clinical sketches to highly detailed and extended accounts of patient's presentation that helps in arriving at a diagnosis and formulation of a treatment plan thereafter, which is essential for the evaluation of prognosis before we start any treatment. Kindly pardon me, this may not be an exact definition from the textbook, but more or less this is what my understanding is. And for those of you who require exact definition, kindly refer some standard textbooks. I'm so sorry. There are 4 pillars in taking a case history. The first pillar being to assemble all the available facts gathered from statistics to chief complaint to medical history, including dental history and the diagnostic test. The second pillar constitutes the analysis and the interpretation of these assembled clues to reach a provisional diagnosis. The third pillar is make a differential diagnosis of all the possible conditions. And finally, the fourth pillar is to select the closest possible choice to arrive at a final diagnosis. Finally, considering all these pillars, we arrive at an effective treatment plan, or we formulate a treatment plan. Moving ahead to the methods of obtaining a patient history, there are basically 3 methods of obtaining a case history. The first one being the interview, the second one is the health questionnaire, and the third one is a combination of the above. In an interview, the patient is asked about his or her health condition in an organized fashion. The patient is allowed to discuss any problem fully. The main disadvantage of an interview is this method depends on the dentist's skill as an interviewer and also requires time to be done well. Excuse me. The second one is the health questionnaire, which is a printed list of health related questions that the patient is requested to answer at the first appointment. Its advantages is it's quick and it offers a standardized approach for each and every patient. But the disadvantage is because it is very quick, there is very little time to build a rapport between the patient and the clinician, and the questions or their format may be interpreted inaccurately by some patients. The last one being the combination method is which is considered by the authors to be the best appropriate technique for taking a case history in a routine practice of dentistry. This combination approach uses the advantages of both the techniques and reduces the disadvantages after reviewing the completed health questionnaire, as the dentist discusses the response with the patient. Moving ahead to the next slide, the next aspect of case history involves the components or the guidelines, which are namely 14 of them, out of which the vital statistics, the chief complaint, the history of the present illness, the medical history, dental history, the family history, personal history, the general examination, extraoral examination, intraoral examination, provisional diagnosis, investigations, final diagnosis, and treatment plan. I'm sorry, the intraoral examination, the spelling is wrong. Now moving ahead, going into the details of individual components, the first being the statistics recording of the patient, which involves recording the patient's name, patient's gender, patient's age, patient's occupation, and the ethnicity, and also the socioeconomic status. The name is very important for communication purposes, to establish a rapport with the patient, and also for the maintenance of records and for psychological benefits. The gender is important because there are certain gender specific diseases, as in there are certain diseases which are more prevalent in females than males, and there are certain diseases which are more prevalent in males than in females. And likewise, age is also very important in the treatment planning, the dose calculation, and likewise there are certain diseases which are very particular in certain age group, and for example, the cleft lip and palate are seen by at birth, and there are other diseases which are seen in young adults and also in the older patients. Age is also a criteria for calculation of a drug dosage. Here in this slide, we have three different rules given by three different people, namely Mr. Eng, Mr. Clark, and Mr. Dilling. Seriously, I fail to understand on what basis these guys have formulated this method, because none of them seem to arrive at a common figure, or rather more of an acceptable number. Khair. Moving ahead to the chief complaint. The chief complaint is usually the reason for the patient's visit to the clinic. It always has to be recorded in the patient's own words, and it is stated in chronological order of their appearances and their severity. The chief complaint aids in diagnosis and treatment, therefore should be given the utmost priority in the case history taking. It is also stated in the patient's own words in chronological order of their appearance and their severity, which I already told you. And the most common chief complaints are pain, swelling, and ulcer. Pain in itself is a very large aspect, so let me not get into it because it may deviate us from the main topic. Moving ahead to the history of present illness, and thus what we do is we elaborate on the chief complaint in detail, and we should ask relevant associated symptoms, and a detailed history of the chief complaint has to be recorded. The symptoms can be elaborated in terms of their mode and cause of onset, the duration, the location, as in whether if it is diffuse or localized, or if it is referred, or if it is radiating. And here of course when I say radiating, I'm referring to the pain aspect, and also the progression and its nature in terms of whether if it is continuous or intermittent. Then again the aggravating and the relieving factors, and if any treatment has been taken. The fourth component in the case history aspect is the medical history. This includes the information from past and present illness, and all the diseases suffered by patient should be recorded in chronological order. A checklist has been given by Christian Scully and Carson, which starts from A to K. And here I always wondered why they stopped at K, because there are 15 more letters in the alphabets, right? And A as in anemia, B for bleeding disorders, C for cardiorespiratory disorders, D for drug treatment and allergies, E stands for endocrine disorders, F for fits and faints, G for gastrointestinal disorders, and H for hospital admissions and surgeries, I for infections, J for jaundice, and K for kidney disease. And of course, the antibiotic prophylaxis is needed in case of bacterial endocarditis. Fortunately, the medical history is organized into the following subdivisions to avoid further confusions which have been created by a lot of people earlier. The following subdivisions are, the first one being the seriousness or a significant illness. In the dental context, we need to ask about any history of heart, kidney, liver or lung disease, history of any infection, immunologic disorders, radiation or cancer chemotherapy, and also in case of psychiatric treatment. The second one is the hospitalization. The history of hospitalization is very important, which shows us a record, or which gives us a record of hospital admissions along with the history of any major surgery. And the third one being the transfusion, a history of blood transfusions including the date of each transfusion and the number of transfused blood units have to be recorded. In some instances, the transfusion can be a source of persistent transmissible diseases. The fourth one being the allergy. The patient's record should document any history of classic allergic reactions such as urticaria, hay fever, asthmatic attack, as well as any other adverse drug reactions. And this has to be reported by the patient in case if there were any episodes of fainting, stomachache, weakness, flushing, or the observation of rash. The fifth point being the medications, again, which is very essential component of a medical history, it is a record of all the medication a patient is taking. It is important because the identification of medications helps in the recognition of drug-induced disease and oral disorders associated with different medications. Finally, pregnancy. Knowing whether or not a woman of following age is pregnant is particularly important when deciding to administer or prescribe any medications and procedure involving exposure of the pregnant patient to ionizing radiations. This slide deals with infants and young adults. We have to take the prenatal, the natal, and the postnatal histories, which are equally important at reaching a diagnosis in case of treating a pediatric patients. The prenatal history is taken from the is basically a maternal history of nourishment, the usage of drugs, and the natal history involves the history excuse me. The natal history records the history which has been asked from the parents if any problem was encountered at birth, such as the Rh incompatibility, such as the father being the Rh positive and the mother being Rh negative, and this may result in a condition termed as erythroblastosis fetalis. The effect may be seen in the dentition with well-described entities such as a hump on the tooth and the characteristic blue-green discoloration. Uh, Again, we have to record the history of a child, its birth weight, whether it was a normal birth or whether it was a low birth, whether the baby was full term, preterm baby, and also whether there was any instance of neonatal jaundice. In the neonatal jaundice, what happens is the immature RBCs in an infant are rapidly destroyed in the spleen. This increased bilirubin cannot be sufficiently cleared by the liver, leading to transient jaundice in the child. And also we also have to record whether there were any trauma during the childbirth, as in forceps delivery, wherein forceps is used to pull the fetus out during the delivery process. And during this process, if there were excessive forces which were being used or applied by the forceps over the temporomandibular joint, there is a possibility of the trauma to the temporomandibular joint, leading to further complications such as ankylosis or even sometimes dislocation. The postnatal history, it is also asked from the parents if any problems were encountered after birth. In this postnatal history, significance is attached to the amount of time the child was breastfed or bottle fed. The vaccination status is also needed which is to be assessed along with the present illness, if any, and the presence of any habit and its duration of frequency, and any previous experience with a dentist, and what bearing it has on the present visit is also very important. And finally, it's also important to note the progress of the child in the school, how he interacts with the children. This will indicate the development of the child's emotion and also the cognitive development and behavior of the child. The fifth component in the dental history being the the fifth component in the case history aspect is the dental history, and thus dental history, past dental history or the history of dental treatment undergone by the patient along with the patient's experience before, during and after the dental treatment is very important, and also a history of complications experienced by the patient previously during any dental procedure, as in whether any procedure was eventful, as in surgical aspects. Moving ahead with the family history, the family members share their genes as well as the environment, lifestyle, and the habits. There are risks for diseases such as asthma, diabetes, cancer, and heart diseases which run in the families. There are several inherited anomalies and abnormalities that can affect the oral cavities, such as congenitally missing lateral incisors, the amelogenesis imperfecta, the ectodermal dysplasia, and cleft lip and cleft palate cases. Moving to the next aspect of the history is recording of personal history. This includes the diet, the appetite, the bowel and micturition habit, and if there are any sleep disturbances, and the oral habits, and any adverse habits. Just a note on the habits, the oral hygiene method, as in a poor oral hygiene and improper brushing techniques may lead to dental caries and periodontal diseases. And pressure habits like thumb sucking, lip sucking leads to anterior proclination of maxillary incisors, and tongue thrusting habits leads to anterior and posterior open bites, and there are certain deleterious habits such as the consumption of tobacco, alcohol should be asked in these patients they have a high tendency for a malignancy. The eighth component being the general examination, we should analyze the patient entering the clinic for build, height, gait, and posture. We should also check for any pallor, icterus, clubbing, cyanosis, lymphadenopathy, and edema. The vital signs like pulse, blood pressure, temperature, respiratory rate should be noted along with the height and weight of the patient. The pulse, the normal rate is varies from 60 to 80 beats per minute, and the average being 72 beats per minute. Likewise, the temperature is 98.6 degree Fahrenheit or 37 degrees Celsius, which is being the normal limits, and the respiratory rate ranging from anywhere between 16 to 24 breaths per minute. And the blood pressure, the systolic being in the normal range being in the level of 110 to 140 millimeters of mercury, and the diastolic ranging from 60 to 90 millimeters of mercury. The extraoral examination also involves the examination of the skin for the appearances of any rashes, sores, or any itching, and whether there is any differences in the color. For example, in anemic patients, the skin is pale and yellow sometimes, and in case of patients with jaundice. And we also have to note whether there are any unusual pigmentation or edema, or there is any raise in the temperature. The facial symmetry has to be noted in the extraoral examinations, whether if it is bilaterally symmetrical or if there is a obvious asymmetry on one side. Now in the extraoral examinations, we start with the musculature, which are important are the muscles of mastication, and the palpation of the muscles of mastication can be helpful in the determination of temporomandibular joint dysfunction and in the discovery of other abnormalities. These muscles are the temporalis, the masseter, the internal pterygoid, and the external pterygoid. The second important examination constitutes the lymph node evaluation. The lymph nodes are oval or bean-shaped structures found along the lymphatic vessels that drain the body parts. Normally, they are non-tender, soft, and cannot be felt even though they are present. In case of any tenderness on palpation, or it has to be noted down, and also along with the mobility of the nodes, or if they are fixed in the okay. There are different levels of nodes. There are totally 7 levels of nodes. The level 1 being there are like I said, there are 7 different levels of cervical lymph nodes. As a clinician, it is very important that we know how to identify these different levels of cervical lymphadenopathy. The first level being the submandibular and the submental lymph nodes. The second level being the jugular nodes, the jugular-digastric and jugular-omohyoid lymph nodes, and the third level being the mid-jugular nodes. The fourth being, the jugular-omohyoid falls under the level 4 and not the level 2. And it also involves the inferior jugular lymph nodes. The fifth lymph node is the inferior to the spinal accessory nerve and also the transverse cervical lymph nodes. The sixth being the central compartments, which are pretracheal and paratracheal lymph nodes. And finally, the seventh cervical nodes are seventh level cervical nodes are infraclavicular and mediastinal lymph nodes. And it also coming back to our main aspect, it is also very important for the us for as a clinician, for us to evaluate the temporomandibular joint. uh, and also the evaluation of the salivary glands, namely the parotid gland, the submandibular gland, and the sublingual glands, is also equally important. The parotid gland, the position is located below, behind, and slightly, as you can see here, below, behind, and slightly in front of the ear. Uh, in case of swelling of the parotid gland, this obliterates the normal hollow just below the lobule of the ear, which leads to the elevation of the ear lobule. And likewise, I'm so sorry. Likewise, the submandibular gland, in case there is any history of swelling with pain at times of meals, this suggests the obstruction in the submandibular duct. It is tense and it's also painful. And we also have to check the duct orifices routinely for any signs of inflammation or swelling. If the gland is infected, slight pressure on the gland will exude pus through the orifice, and in case if there is obliteration of the duct because of the presence of a calculi, then the normal flow of the saliva cannot be appreciated. Coming to the intraoral examinations, this intraoral examination constitutes a soft tissue examination and a hard tissue examination. In the soft tissue examination, we start with the lips. The lips are checked for color, texture, any surface irregularities, and we need to palpate the upper lip and the lower lip to evaluate in case of any thickening or induration, or also in case of any swellings. And the second one is the tongue. Likewise, tongue examination is also done to check for the volume of the tongue in case if it is enlarged or excuse me. In case of the tongue is being enlarged, it can signify the lymphangiomatous changes or hemangiomatous changes, or also the presence of neurofibromatous changes. The integrity of the papilla has to be noted. Any signs of cracks or fissures, or even the presence of ulcers or the presence of a tongue tie should also be noted. The third soft tissue examination constitutes the evaluation of the gingiva, starting with the color, then the contour, the shape, the size has to be evaluated carefully. The color of the gingiva being coral pink, any physiological pigmentation may also be seen sometimes, and the contour depends on the shape of the teeth and the alignment in the arch. The location and also the size of the area of proximal contact and dimensions of the facial and the lingual embrasures is important in the differentiation of the normal contour of the gingiva. The scalloped outline on the facial and the lingual surface should also be noted. And regarding the shape, this is governed by the contour of the proximal tooth surface and also the location and shape of the gingival embrasures. The size of the gingiva corresponds to the sum total of the bulk of cellular and intracellular elements and their vascular supply. Likewise, the consistency of the gingiva, normally which is firm and resilient with exception of a free gingival margin, has to be noted. And the surface texture, which is orange peel appearance, which is also referred to as stippling, has to be noted. The position of the gingiva has to be noted. In case there is a recession, the recession can be localized or it can be generalized in terms of the periodontal status of a tooth. The other type of soft tissue evaluation is the evaluation of the hard palate, the soft palate, the position and the size of the uvula, the presence or absence of tonsils, and also the tongue, which has already been discussed. Finally, the floor of the mouth has to be evaluated for any signs of change in color, presence of swelling, or as in case of ranula, the floor of the mouth is elevated. Okay. The second aspect of intraoral examination deals with the hard tissue evaluation.